this afternoon. Thank you for coming. One of the things I find is that, this can be a time of change and challenges, and there may be some emotional or physical or psychosocial challenges that you're experiencing right now. And one of the things that we try to do at the PCSC program is actually provide knowledge to help empower you. So I'm hoping, again, that tonight or this afternoon, this is going to give you some background information, some food for thought, and I just really want to applaud you for all, taking the time and coming here today. Okay. As I said earlier, my name is Christine Zarowski. I'm one of 2 sexual health clinicians with the Prostate Cancer Supportive Care Program. Monica Tankon is the other sexual health clinician who works with me. So what I want to do is talk today is about various things. I want to talk a little bit about sex, sexuality, sensuality, and some myths, looking at what normal male sexual function is, or the sexual response cycle. We're going to look at what erectile dysfunction is about. We're also going to examine how prostate cancer and treatments can affect your sexual function, how to manage the different symptoms, what is the sexual adaptation process, what does that look like in light of prostate cancer treatments, therapies and sexual aids for erectile dysfunction, communication and intimacy, and also where to go for further support and information. So again, there's a lot of information that's going to be presented today, and basically the degree of relevancy of this information will depend on where you're at in this prostate cancer journey. Okay. Sometimes what I find is that individuals go through different types of thoughts, and sometimes early on in the prostate cancer journey, different thoughts might be expressed like this. I no longer feel like a man, or I feel depressed. I'm concerned that my partner might leave me. I no longer feel connected to my partner. I'm not sure how to reconnect with my partner. I feel guilty about thinking about sex. I should be thankful that I'm alive. I feel like a failure. Is this normal? I mean, there's a lot of positive thoughts that individuals experience as well, but I wanted to draw these because a lot of times people have these thoughts and they feel that they're the only ones going through this experience, and they're not. And a lot of times this experience that they're having is very, very common. Partners can also have similar kinds of thoughts as well. When we consider, as I mentioned before, that prostate cancer, we consider it to be a couple's disease. And one of the things that I find with these particular thoughts is that over time, with support and understanding, these challenging thoughts will be replaced with more positive thoughts as you evolve through the prostate cancer experience. And for those who wish, while they redesign their sexual life and the corresponding values around their sexual health and sexuality. So bringing that to sexuality and sexual health and sensuality, these are something that are very relevant in our lives, but sometimes we don't have words to describe what do they actually mean. So I wanted to take a little bit of time to talk about that. So when we think about sexual health, it's the integration of physical, emotional, intellectual, and social aspects of sexual being in ways that are positively enriching, that enhance personality, communication, and love. So sexual health is not just disease-focused. There's a lot of different components that are related to that. For some individuals, they might say, so what does sexual health look like? Does it mean that I have to have like 6-pack abs and have sex 5 times a week? Well, no, it's not about that. What it means is being able to channel your needs and feelings into means of expression that allow you to get physical and emotional enjoyment. It means that you feel comfortable and safe with who you are as a whole person, including the different dimensions of your sexuality. Oops. Okay. Sexuality, again, a definition here, encompasses all the feelings, attitudes, and behaviors that contribute to a person's sense of their self, both publicly and privately. So what we find is that sexuality actually spans through our lives. It's not just a set stage in our life, right? It's an integral part of being human. It is a complex set of personal, social, spiritual experiences that go beyond just sexual activity. In other words, sexuality is not just about what our body does or what we do with our bodies, but it's our thoughts, fantasies, desires, beliefs, attitudes, values, and practices, and relationships, and how they are experienced, right? And also how they're expressed. And that's coming from the World Health Organization. When we think about sensuality, it's our ability to feel pleasure sensations and emotion through utilizing all of our senses. To be sensual, you really need to be present in the moment and paying attention to what you are experiencing in that moment. Some reflection of mindfulness, which we'll talk a little bit about later. I really like this wheel of sexuality. This actually, again, helps to really identify all the aspects of your sexuality. We know that there's biological influences, psychological influences, and social influences. We know that it's also impacted through culture, religion, our upbringing, our socialization, life experiences, and our society. One of the things that we see at the very top of the circle is values and beliefs. Values and beliefs are very important because they guide us around our thoughts, around sexuality, our sexual self, and our sexual activity. So one of the things that really need to pay attention to is where are those values and beliefs coming from? Our society actually gives us lots of different messages, and some of those messages are wrong. I call them actually societal myths, okay? So some of the myths that we see out there is things like good sex requires orgasm, or sex means sexual intercourse, or sex should be spontaneous with no planning, no talking. Men should initiate sexual activities. Male orgasms require erection. Sexual aids are perverted. Sex is for young people. I mean, there's lots more myths out there. And the key thing is to recognize is that when you look at your own values and beliefs, whether or not they are actually influenced by these myths, okay? Because if they are, then sometimes when we see changes with our sexual health or sexual function, that's where we run into problems, right? So it's interesting, I had done one of these education sessions, and the fellow, we'll call him John, he came up to me after the education session, and he goes, Chris, he says, I really enjoy being a sexual person, but I know I shouldn't because I'm 83. And that was really, really hard to hear, because for him, he was governed by part of these myths. Sex is for young people. I mean, if that was a fact, I think I would be pretty upset about that. Okay. The other thing that I came across is there's a sex therapist, his name is Mitch Tepper, and he's actually a man with a spinal cord injury. And he actually wrote a paper about perspectives of men who are experiencing disability or chronic changes with their sexual life. And one of the things he pointed out in the article is that our society is really, really tough about concepts around masculinity. Like it's when everything is optimal or optimally functioning, it's very hard for a man to kind of achieve those standards of expectation of what does it mean to be a man. So again, when there's changes, we find that's where individuals kind of struggle with their concepts around, say, masculinity and stuff. So it's things to be kind of aware of. So one of the key things that I always like to tell individuals is that you are still a sexual person even with sexual changes. And that's really important to recognize and take that to heart. For some individuals, sexual activity may or may not be important, right? But for a lot of men that I work with, and I think I have about 1,300 in my life right now, is that, for some of them, erections are still, quite important to have, even if they're not being sexual with them. It's part of their identity, right? If a person's choosing to be sexual, creating a sexual life, sometimes it takes time and experimentation to figure out what works well for yourself or for your partner, right? And then also what's really important to know is that a lot of couples I work with, intercourse is their primary focus when they're being sexual, and they don't realize that there's other avenues that they also can explore. Things like sensual massage or oral sex or mutual masturbation or examining different types of sexual toys or aids. So again, what's really important in this situation is that your sexual life is your own, and it's you and your partner who should decide what is important and comfortable. So what is the normal male sexual response cycle? Okay, so there's lots of different models out there, but I just sort of briefly talk about this. First, we have the sexual desire or sexual drive or libido, or sometimes I call it sexual appetite. Then there's the erectile response that happens, or how the body, it's not just the penis, but the whole body responds, but we're going to focus on the penis right now. Orgasm and ejaculation, then resolution and refractory period. So those are the four kind of stages that we sort of see. One of the things I wanted to point out about sexual desire is that there are a lot of factors that can affect sexual desire, both physical and emotional. And it's not just for the male, but also for the female as well. So things like stress or anxiety or depression, relationship challenges, erectile dysfunction, premature ejaculation, pain, medication, testosterone, all these kind of factors can really affect desire. So if, what I usually, when I'm working with couples or individuals, if we see that there is an impact, we identify what are those factors and how do we manage those, right? And also, like I said, it's not just for males, but for females as well. When we think about erections, it's like I wanted to take a couple slides just to talk about like what's in the penis and how do erections develop. So this is actually a cross section of the penis, and what you'll see is that there's actually these chambers here. These are called corpus cavernosum, okay? They actually house the erectile bodies inside the penis. So what happens is that inside those erectile bodies there's these little tiny spaces called sinusoids, and they're surrounded by different types of tissue, including smooth muscle. So what happens when that smooth muscle relaxes and opens up, it actually allows the blood to come in to help foster the development of the erection. So what that means is that, first of all, when there's actual sexual arousal, it actually causes different kind of chemicals to begin to flow in the body, and that leads to development of erection. So the brain sends messages down to the nerves around the prostate gland, telling the blood vessels to open to let the blood to come into the corpus cavernosum, or those spongy erectile tubes. When we see that once the tubes expand, this creates that erection, and then there's something called the venous occlusive mechanism. So what this means is that around the penis, around the corpus cavernosum, there's actually this sheath. I used to call it saran wrap, but it's thicker than saran wrap. It's called a tunica. And what happens is as the penis engorges, that tunica begins to tighten and closes off the blood vessels. Once it closes off those blood vessels, that's how the erection is maintained, okay? So what can happen is that if that mechanism is not working properly, a man might be able to get an erection but can't maintain the erection. Okay? So when we think about erections, what we need for erections are, number one, healthy blood vessels, number two, functioning nerves, and number three, healthy erectile tissue. So that's something to keep in your mind, okay? So the other aspects, again, of sexual response cycle, orgasm and ejaculation, a lot of people feel this is one of the same, but they're not. They happen sometimes at the same time, but they're actually two different identities, okay? With ejaculation, that's when you see that there's a movement of the semen, right, coming out of the body, and then orgasm, usually it can be part of the mind experience, it can be part of the body experience. And one thing to remember is, again, what I said in the myths, is that even if a man does not have an erection, he can still be orgasmic. Okay, so that's something to remember. Resolution refractory period, basically what that means is after you've gone through the sexual response cycle, after orgasm, after ejaculation, there's a period of time needed for the body to recoup, so before being able to be sexual again. So when we think about erections, is that there's different variables that can contribute erections, right, that can affect erections. So number one, medications. Things like antidepressants, for instance, or blood pressure medications. Those can actually affect, it can affect part of desire, but it also can affect how a person is able to respond sexually. Medical conditions such as diabetes or cardiovascular disease or high blood pressure. A lot of those kind of conditions affect blood vessels, right? And we know that blood vessels are necessary for healthy erections. Lifestyle factors. Smoking, again, affects blood vessels. Alcohol intake, obesity, limited exercise. Other factors that can affect our bodies responding sexually is psychological or emotional issues, including stress, anxiety, or depression. Makes sense, right? Yeah. So when we think about erectile dysfunction, we know that it's something that's very common. In fact, approximately about a third of males over the age of 40 will experience some degree of erectile dysfunction. The other thing about the prostate gland is that the function of the prostate gland is actually provide the nourishing fluid for the ejaculate. Okay, so it's not really directly involved with creating erections, but what is important is that there's these neurovascular bundles, or these bundles of nerves near the prostate gland, right? And it's those nerves that are very important for creating erections. So here's a nice picture of this. So these are called the nerves of Walsh, and so it's the cavernous nerves. And as you can see, that they're very, very close to the prostate gland. So you can see that, through, say, radiation or surgery, that those nerves can be affected. Okay. So let's look at how the prostate cancer treatments can affect sexual function. Okay, this is a pretty complicated chart, but when you have more time, you can actually spend more time looking at this. But basically what it does is break down some of the primary treatments for prostate cancer, the prostatectomy, radiation, androgen deprivation therapy, and also looks at active surveillance, right? Active surveillance meaning that prostate cancer has been detected, but because of the characteristics of the cancer, there is no need for treatment at this point. Variables that we look at that are impacted is things like sexual drive, erection function, orgasm, ejaculation, whether or not there's changes in the anatomy of the penis, whether or not there's urinary issues, bowel issues, or other issues. So when we think about active surveillance, a lot of times there's not a direct impact on how we feel as ourselves as a sexual individual, or how our body responds sexually. But what I find is that if there's anxiety, right, with having the cancer diagnosis, that can actually impede on sexual drive or how the body's responding sexually. Right? Again, with orgasm, it can be altered as well, because if you're not feeling sexual or you're being distracted, it's hard to actually, achieve orgasm. With prostatectomy, the key thing that we find is that there's usually changes right away. And the reason why is that, first off, when the surgeon is going in to do the prostatectomy, the primary goal is to get rid of the cancer. And so through the diagnostic procedures, they can't always determine where the cancer is, whether or not it's gone beyond the prostate gland. So once they detect that it has been isolated within the prostate gland, they try to do what is called nerve sparing. Okay, so nerve sparing, remember we talked about those cavernous nerves? So it's almost like peeling layers of onion away from the prostate gland. And so what happens is those nerves, those cavernous nerves, they're very, very finicky. They're very fragile. They don't like to be touched. They don't like to be looked at. So that what happens is they go into what we call a shock phase. It's called neuropraxia. And so in that shock phase, they're not working anymore. So that's where you see that there's immediate change with the erections. Right? Recovery of those nerves, it can take up to 4 years, right? So it's a very long period. And so and I'm going to be talking about the principles that help with sexual adaptation, one of them being patience, and that's where it's really important to have that. Because a lot of times men say if they've had the prostatectomy, maybe at 3 months or 6 months, they're feeling better in the fact that they're back to their jobs, their exercise program, but there's the other kind of consequences, the sexual changes, maybe the urinary changes are still there, and they're upset, like, well, I feel better, like I've healed, why hasn't these healed? And that's where it takes time for those things to recover, right? So things that we see again with orgasm, for instance, is that the experience that I've had is that sometimes in the beginning with prostatectomy, they might experience some discomfort with orgasm that usually resolves over time. But 40% of men will tell me that it's pretty much the same, the experience of their orgasm. 40% will tell me that it's different, but it's still pleasurable. And then there's these 20% of men, and they're like, man, my orgasms are off the roof. They're better. In fact, some of them learn the secrets of women that they become multi-orgasmic. So again, the thing about orgasm is still, if during the recovery period, if the erection is not there, orgasm can still be achieved. The other thing that we see is that ejaculation, there's going to be no ejaculation after prostatectomy. Sometimes what can happen is there might be the movement of urine, which is called climacturia. So climacturia is the release of urine at the time of orgasm. The other thing that we see with urinary issues is that sometimes there's what is called stress incontinence, right? So a man goes to pick up a heavy object, or moves suddenly, or coughs, so there might be a little bit of leakage. And that's where the pelvic floor is very important, to strengthen that pelvic floor. And like I mentioned, we have module number 5 that deals with that training. When we think about radiation therapy, whether it's brachytherapy, which is the insertion of small little pellets into the prostate gland, or external beam radiation, would actually focuses on the prostate and the prostate bed, what I find is that the side effects are more delayed. So what happens is it takes time for the radiation to actually begin to affect the prostate gland. It takes time for it to affect like the surrounding nerves or the blood vessels, etc. So there might be a slow decline with, say, the erections. The other thing is with ejaculation, initially there might be some blood that's noted in ejaculation, which can be quite frightening, especially if somebody hasn't said anything about that. The other thing over time is that the amount of ejaculate begins to reduce because the functioning of the prostate gland is beginning to reduce, right? The other things that we see that with radiation is that with urinary issues, I find that there can be more frequency. I find that there can be more bowel issues, again, with radiation, because when we looked at that previous picture, we saw that the rectum was quite close to where the prostate is located. So if the rectum is actually receiving some radiation, that can cause some inflammation and irritation as well. The other things that can happen is radiation burns or skin irritation. With androgen deprivation therapy, this is a type of therapy that actually reduces the production of testosterone in the body. So what testosterone does, it kind of gives you that oompa for life. It kind of gives you that vitality. The other thing is testosterone is very involved with sexual function. So when you don't have any testosterone, you know that that's going to take away from the ability to actually create erections. The other thing that we find a lot with orgasm, it might take longer to get, we call getting up the orgasmic mountain when men are on androgen deprivation therapy. Also, the sexual drive is usually eliminated, right? So in a situation, if you have a heterosexual couple where the male might be the instigator or the motivator for being sexual, and that male is has no kind of like sexual appetite and it's not on the radar, then what happens is sometimes the partner's like, well, what's happening with John? Like, why isn't he interested? And so it's that there's that communication kind of breakdown. So what I always say is that for men that say on androgen deprivation therapy is that a man on ADT can still have sexual pleasure, but it's getting that step to being sexual. So again, for couples, like sometimes there has to be a bit of a role change. Maybe the partner now has to be the initiator of the sexual play. The other thing that we find with androgen deprivation therapy is that there can be changes with the anatomy of the penis, which can be really upsetting. Also, there are other things like there could be weight gain, there could be breast swelling or breast development, or fatigue. And so some of those things, again, it really can affect part of the sexual self-view or the body image for that person. So thinking about those types of things, that all prostate cancer treatments will affect part of your view about yourself sexually and also your sexual functioning. The rate of recovery will be dependent on, for instance, the length of the treatment, such as with androgen deprivation therapy, and also your body itself. And I'm going to talk about variables about what can affect recovery a little bit later. Wanted to put a quick little slide in here about fertility because a lot of times we're finding there's more younger and younger men that are being diagnosed with prostate cancer. So what we do know is that the prostate cancer treatments can affect men's fertility. With prostatectomy, there's no ejaculate fluid, so that usually carries the sperm out of the body. Brachytherapy, There may still have fertility preserved, but over time the ejaculate fluid will decrease, and with external beam radiation it can extend to the testicles or the testes where the sperm is being produced. So again, that can affect reproduction. So the main thing that we say here is that if an individual is planning on children in the future, it's highly recommended that they actually bank sperm. I had a story, one of my patients, he was actually diagnosed when he was 43 and wasn't partnered at the time, and eventually got a partner, and they actually have twins and they're 6 months old now. So yeah.
Well done.
That's great. It was a very nice story. It gives me goosebumps.
Oh.
Yeah, it gives me goosebumps. Yeah. So the key thing here, yes, you can have good sex life after prostate cancer, and one of the things I find is that, you know, a lot of the couples that I work with is that they've been in relationships for decades, right? And which is fabulous. You know, bravo for them. And a lot of times when it comes to like their sexual life, is that they have a pattern of how they're sexual with each other. And there's nothing wrong with having a pattern. Like, why change something that feels good, that's known, right? That provides pleasure, why change it? So what I usually say is that this prostate cancer experience actually creates opportunity. And I have a lot of individuals, whether they're single or in a couple relationship, that they've actually feel that they're in a better space in regards to their sexual life, just because of things that they needed to do, whether exploration, communication, all those types of variables, right? So again, that we know that there's going to be a change, but you can have, if you choose, you can have a sexual life that you feel comfortable with. So in this section here, I just wanted to talk a little bit about how to manage some of the side effects or some of the sexual consequences, right? So how to begin? First of all, talk to your partner. If you're in a partner situation, talk to your partner. You know, a lot of times I'll ask the question, do you feel comfortable with talking to your partner about this experience or talking about sex, you know, with your partner? And a lot of times people will come back and say, oh yeah, I feel totally comfortable. I said, are you talking? And they're like, no. Or they don't really know how their partner feels about what they're going through. And so this is where it's really important to you know, to begin the dialogue. And it can be really challenging to begin that dialogue, right? Discuss other ways you can enjoy sex without penetration. So that's the other thing, and this is where it creates that opportunity. And sometimes people, like, they don't know where to go or where else is there. So that's where, you know, Monica and I might be able to help, like, with the resources or just to have conversations around that. When you're beginning to explore different things, let them know what feels good and ask them what feels good for them. So again, having the dialogue around it is important. The other thing is request an appointment to come see, you know, either myself or Monica. The other thing that's really can be really helpful is seeking a counselor, because a lot of times, you know, sometimes having some facilitation around the conversation is helpful, because we're not really told, like, even as we're growing up, we're really not told, like, how to talk about intimate things, like, with our partner. It's sometimes, you know, can be a struggle. So having another person, whether it's, you know, Fred, our counselor, or our community sex therapist, or another counselor in the community, that can be really helpful. Right there, it can be very helpful in working out emotions through this process, which assists in a positive sexual adaptation. All right. So when we think about urinary incontinence or climacturia, again, I mentioned about strengthening the pelvic floor. Again, you know, connecting with their pelvic floor physiotherapist would be really good. In fact, she actually has an education session much like this one that I would encourage people to take to look at, for sure. Some practical tips that we find that are helpful is that emptying the bladder before being sexual. Also thinking about sexual activity, what kind of pressures are being placed on what parts of the body, so looking at positioning. Avoiding irritants for the bladder, such as caffeine or alcohol or spicy foods. Protecting the play area, which is helpful. Wearing a tension band, you know, maybe at the base of the penis, right? That actually can occlude the urethra a little bit, so the urine is not coming forward. Being sexual in a place where it doesn't matter if there's some urine, right? In a shower or a bath. And some individuals, they just keep there might be just a little bit of urine leakage, so they just keep a scented towel handy just for a quick little wipe up. So those are just little practical things. When we think about arousal, Again, enhancing the environment, like looking at lighting. I had lightning in there before, and I thought, well, maybe we should add a little bit of lightning in there, right? Music, aromatherapy. You know, our mind is our biggest sex organ, and how we interpret situations are very important. So when we have things that kind of, you know, create comfort and soothe, that actually can help with the arousal. Mindfulness is something that is really, really powerful, that we find has been very helpful with a lot of different things, whether pain management, and we find mindfulness is actually something that's great for keeping people being present in that moment without judgment, right? And that it allows you to stay away from distractions. Simmering is a process of maybe you have like a pleasant sexual memory that you have, and you kind of bring it to the consciousness and think about it. Maybe let it go, bring it back a couple times throughout the day, and then what happens when you choose to be sexual, it actually might help to kickstart that sexual response cycle. Dedicate time, right? Sometimes our lives are so busy, right? Next thing you know, it's like it's been 3 months, right? We plan a lot of things in our life. We plan vacations and stuff, so sometimes planning, having intimate moments together, and if you have planned it, at that point you can sort of decide, what do you want to see? You know, are you going to do that 5-hour marathon, or are you going to have a 5-minute hug, right? You make decisions about what would be important, what is comfortable. Even taking a mini vacation. Again, like a lot of times in our home environments, there's lots of things happening in our life. So sometimes it's hard to kind of like, I just want to be with you, or I just want to be with myself with you, right? So when we think about orgasm, is that we talk about staying pleasure-focused versus goal-directed, right? And this is hard. This is a hard kind of training process, because as soon as you begin to think, like maybe you're engaging in some sexual activity with your partner, and as soon as you begin to think, what's my body going to do, right? Is there going to be an erection, or is there going to be orgasm, those types of things? Then what happens is you're moving away from what I call the playing field, right? The sexual playing field, and you're way up there in the bleachers. Meanwhile, your partner's down here going, John, come back down, right? So pleasure focus is very important. Focusing on breathing techniques, you know, experiment with breathing. Sometimes a hastened breath might bring orgasm faster, or a prolonged breath might enhance the orgasm. Incorporating different sexual aids such as vibrators, changing the type of sexual stimulation, you know, also even altering the rhythm of how the sexual stimulation is being provided. So those are some things that can help with orgasm. Okay. When we think about hot flashes, and a lot of times men, again, who are on ADT might experience this. So one of the things that we look at is, first of all, identify where are the triggers for hot flashes, right? Is it that steamy hot shower that you have every morning? Is it that spicy burrito that you had at lunchtime? So figure out what are the triggers and try to avoid those. Wear natural fiber clothing such as cotton. You can layer your clothing. Acupuncture might help, and also there's different types of medications that have been helpful with managing hot flashes as well. Also, module number 4, we have a nurse practitioner. He actually is able to look at the different symptoms that you might be having, and actually provide recommendations around those. When we think about weight gain or decreased energy, review dietary intake and habits, right? We have a dietitian in our module number 3 that can be really helpful in looking at those types of things. Journal your energy cycles. A lot of times people might find that, you know, like that 1 to 2 in the afternoon is their low time, and maybe that's the time to avoid like strenuous exercises, or they find that their energy is, you know, better in the morning. So even if they find they have better energy in the morning but not a lot of it, if they're choosing to be sexual, take turns being the giver and the receiver of sexual pleasure, right? Review sleep characteristics. Are you getting a good night's sleep? Are there been changes? Sometimes men on ADT, they might be prone to what is known as sleep apnea. Sleep apnea is a disruption of your sleeping or your breathing pattern during nighttime. And so what happens with that is that if you're not getting your good sleep at nighttime, that's going to affect your energy, etc., right, and mood. And then, of course, exercise. We know that exercise is something that's been very, very valuable with our complete wellness, right? And we have an exercise physiologist that's associated with our Module 3. So again, another support that you can access. So what are the factors that can influence sexual recovery? Is age. And what we find is that the younger the man is, the better chances that they have at recovery. The oldest I have in my practice right now is 93. He's doing pretty darn good. So, existing diseases, like we mentioned before, we looked at the factors that can affect, say, erections. So if there's existing diseases, we need to address those, make sure that those are stable. What are the medications? Smoking, right? We talked about smoking before. What was pre-treatment prior to the prostate cancer treatment? What was the pre-treatment sexual functioning? So if a man was, say, having challenges with, say, creating and maintaining erections, that's going to be still an issue afterwards, which needs to be addressed. Also, preservation of those cavernous nerves, right? That's important. If those nerves are not preserved, or if they're not functioning, that's going to affect the ability to sort of create erections. And I'm going to be talking about things of helping to support erections, even if the nerves are not functioning or they've been removed. And then finally, what we see here is maintaining healthy penile tissue. And I'm going to be talking about penile rehabilitation soon. So again, what I said earlier, recovery can take a very long time, right? So you got to be mindful of that. And the other thing is that your body is going to have the final say of how it's going to recover. So right now, I'm going to have, Jenna's going to come up, and she's going to prepare, we got 2 video clips of these individuals. They're both obviously had prostate cancer, and the first gentleman's name is Martin. Yeah. So the message is that I wanted to, there's lots of great messages in there, and you actually have the links in your PowerPoint if you want to review those again. But the key thing that I see is perseverance, right? It took them time to figure out what worked for them, which is very important. So that's where we're going to be coming to sexual adaptation next, okay? So when I think about sexual adaptation, it's definitely a process. So it's the process of sexual adaptation following prostate cancer treatment. It's very complex, and it warrants the need to apply the principles of acceptance, flexibility, patience, and persistence. These are the principles that I find that have been really helpful for individuals as they navigate this experience. The process, it can include grieving loss and moving forward with new ways of being sexual, right? Redefining one's sexual self-view and corresponding sexual values. What we find with sexual adaptation, it can include sexual and penile rehabilitation. Sexual penile rehabilitation, it's like philosophy of care, applying restorative and rehabilitation principles to adapt to the limitations and to maximize potential while remaining open-minded. So that's part of that flexibility. So the open-mindedness is very, very key as well. Right? So we do know that I find, again, the process takes time. I find that individuals and couples will go through different stages, which includes different degrees of readiness, right? So like I said, even today, like there's lots of information that's being provided. Some of it's going to be pertinent now, some of it maybe later, right? Then the other thing that I find is that when a person goes through a positive sexual adaptation, what we find is that they've been able to enhance their sexual knowledge. They've been able to reestablish or and developing a positive sexual self-view, including aspects around body image, masculinity, femininity as well. And also what they do is they'll if they choose to redesign and renegotiate sexual behavior and activity. So this next statement is actually a quote from one of the patients that I worked with. And basically he shared with me, he says, Chris, he says, this experience gave me a license to be intimate with myself. And I thought that was something that was very, very powerful, because a lot of times in our life we don't give ourselves permission, right? And so this is one of those aspects in life that we need to give ourselves permission. So the next section I wanted to talk about what are some of the therapies or sexual aids for erectile changes, okay? This first slide is just a summary of different types of things that I'm going to be talking about. Medications, suppositories, injections, pumps, tension bands, prosthetic penises, harness, penile implants. Colin and Martin shared some of these with you just a few moments ago. But before I go to that, I want to talk about penile rehabilitation. Who's heard of that term before? Anybody? Okay, so I got a question. Why do men have like nocturnal or morning erections? sometimes they're called REM erections. Do you know why that happens? I'm quite jealous about this, because basically what happens, a man sleeps and the penis works out, right? I wish when I slept my abs worked out. They don't, right? So what we find is that usually a man might have between 3 to 6 erections during the night. They're not sexually induced, right? But it's a way of the body keeping the penis healthy. So what we find is that through prostate cancer treatments is that a lot of times that biological process is disrupted. Same with the sexual erections, right? So that's why it's really important that people begin to do penile rehabilitation. Basically, it's physio for the penis, right? It's like our bodies. If we don't exercise our bodies on a regular basis, thank you, Jenna. If you don't exercise our bodies on a regular basis, our bodies will get deconditioned. The same thing happens with the penis. So how long does penile rehabilitation go on for? Well, until until the spontaneous or the sexual erections come back, you want to continue to doing penile rehabilitation. And as I mentioned before, like with, say, surgery, it can be up to 4 years before the body heals, right? But also remember, it's your body that has the final say. When we think about how often is it done, we say minimally at least 3 times a week. So that could be part of penile rehabilitation, that could be part of sexual play, right? The other thing is it's very important to be proactive, to develop a plan. Before, a lot of doctors would say, just wait and see. John, just wait and see what happens. We know we shouldn't just wait and see. You need to be proactive with that. Sometimes what we see is sometimes men might be given low doses of PD5 inhibitors, right? This is a medication that inhibits a certain enzyme in the body to allow blood flow, right? So a lot of times a man might be given a prescription for a low-dose PD5 inhibitor, such as Viagra 25 milligrams or Cialis 5 milligrams, but they're not told why to take it. And so they don't take it because they're thinking, oh, they just had surgery. I don't want to be sexual, right? I'm not going to take this, right? So that's something that can start, the low-dose PD5 inhibitor. The other thing for penile rehabilitation can be the vacuum erection device, right? This is one of the things that we need to do is make sure that blood is coming into the penis, right? So this is an example of a vacuum erection device. There's different ones on the market. I'm not going to talk too much about this, but I just want to show you this one, particular one. So what we find is that with the vacuum erection device, it will probably bring in about 50% oxygenated blood into the penis. So that's blood that's rich in oxygen. The cells inside the penis need to have oxygen, or otherwise they'll shrink and they could die, right? So we're using the vacuum erection device as one way of bringing that blood into the penis, making sure that the penis is getting the physiotherapy it needs, plus the oxygen it needs. The other thing that can be helpful for penile rehabilitation is those injections, and I'll talk more about those injections. But they can be started as soon as 4 weeks after, say, surgery, or if after radiation as well. The last thing I have in here for penile rehabilitation is penile massage. So what I find is that if the body has changed, if, say, a man is not getting the erection, what happens is that he does not want to touch his penis anymore. Right? Or the partner, if they're trying to engage in some sexual play and the penis is being touched but it's not responding, the partner's like, oh, is it me? Like, there's feelings of awkwardness. So why I say doing penile massage, because it's part of penile rehabilitation, but it also allows the individual to get more comfortable with the body part, right? So again, that's one of the reasons why we talk about that. And there's different ways that you can do the penile massage. I won't go through that right now, but again, those are the things that are helpful for penile rehabilitation. So that is important, right? Especially as your body's going through recovery. So let's talk about those medications that can help for supporting erections. So the first one was the oral medications, which again, those are the PD5 inhibitors. They, again, like I said earlier, inhibit a certain enzyme in the body to allow testosterone to work with other kind of chemicals, to allow relaxation within the penis, to allow the erection to occur. So with these medications, we have short-acting, we have long-acting, and we have, again, for daily therapy, penile rehabilitation, which I talked about, the Cialis 5 milligrams. So the short-acting Viagra, Levitra, and Staxin, again, it shows it's only in the body maybe 4 to 10 hours, right? Whereas the higher dose of Cialis can stay in the body up to 36 hours, right? whenever you're using these medications, it's important that you have good sexual thoughts and sexual stimulation. John phoned me the other day, months ago, years ago actually. He goes, Chris, I took the Viagra, I went to the garden, I sat and I waited. Nothing happened. Nothing's going to happen if you're not proactive with that, right? So arousal is really important. The other thing is, remember I talked about testosterone, right? If somebody's on androgen deprivation therapy, the testosterone is 0, you may not respond to these pills because they rely on testosterone, right? The other thing is, if you're going to experiment with these pills, a lot of times people say, Chris, which is the best one? I say to men, try all of them, because you might be a better Levitra responder compared to a better Cialis responder, right? The other thing is that you got to try them at different time intervals, right? Don't just try them at whatever, 3 months or 9 months, and if they don't work, that's it, you give up. You got to try different time intervals because, again, depending on how those nerves are working, because again, the nerves are very important with the PD5 inhibitors as well. And again, we know recovery can take a long time. Potential side effects with these pills is things like nasal stuffiness or facial flushing, headache, indigestion. Sometimes there could be visual changes, sometimes hearing changes, sometimes joint pain, right? I see the joint pain a lot more with the Cialis. Most men don't have a lot of side effects with these medications, right? So the main contraindication with the PD5 inhibitors is that you do not want to combine them with nitroglycerin. So medications that's used for controlling chest pain, okay? Because basically this can lower blood pressure, and nitroglycerin will lower it even further. So you can bottom out with that. Yeah. The other thing, did you know that Viagra? I think it was created back in 1998. Do you know it was actually meant for cardiovascular health? But men were getting these great erections and just opened up the door to all sorts of positive stuff. Yeah. So that's what I wanted to tell you about the PD5 inhibitor. So that's one source of maybe supporting erections. The other is Muse. Remember they showed a little picture of the suppository. So that's a suppository that goes right inside the penis. The success rate with the Muse, I don't find it that successful. It's expensive. One little pellet is between $40 to $70, right? The guys in the UK, they love this thing, but I think they get it for free. And that's probably why they have more success with this, right? But it is an option for using that. The other thing, they both, Martin and Colin, talked about the injections. The injections, not only are they economical, but there's also, they can potentially be covered. The other thing is they're 90% effective, right? The other thing that to remember about the injections is that if you don't have any testosterone, or if your cavernous nerves are absent or not working, you will still get an erection with the injection, right? I like the appearance of the erection that you get with the injection, because there's bringing in more of the oxygenated blood, so the erection is looking more regular, right? Whereas sometimes with using the vacuum erection device, the erection might appear a little bit more dusky or a little bit more darker in color and a little bit more cooler, because you're locking blood into the shaft of the penis, and it's only 50% of the oxygenated blood. So again, with injections, a good success rate with that. We do the actual training for the injections. Okay, vacuum erection device. Again, it is very effective as well, but you have to be patient when you're learning how to use this. Same with injections; it takes a while to get to the dose that you're happy with. I won't talk about the. I'll talk briefly about, going back to the injections for a second, about the potential side effects: priapism, which is prolonged erection, and scarring, which can lead to porones. The chances of those happening are very low, especially with priapism, because when we do the training, we start you off on a very, very low dose, and then we titrate up depending on what type of erectile response you get, right? Again, with the vacuum erection device, I think it's really important to have some guidance around using that. Also, arousal is helpful when using the vacuum erection device. There's a little tension band that's used. There's a good picture here. There's a little tension band that you can see that sits at the base of the penis here, right? So one of the things that I suggest about that is that if there's a lot of pubic hair in that area, you want to trim that hair unless you like pain. right? Because trying to get that band off is not a fun thing to do, especially when there's entangled in hair. The other thing is lubricant at the base of the penis is helpful as well. The other big thing to remember is you don't leave it on for more than 30 minutes. So you don't roll over and fall asleep, because you won't be happy when you wake up the next day, right? So you need to remove that. But again, it's quite effective. The other thing that we find is that sometimes, like, remember I talked about the venous occlusive mechanism, that mechanism to help maintain erections? Sometimes that gets disrupted, so some individuals will use tension bands, right? So they'll create the erection and then they'll apply the tension band, and that will help to maintain it. There's just some examples there. Again, the penile implant. A lot of times people think of this as a last resort. It's not really the last resort. It's just that a lot of surgeons will not do a penile implant until an individual's tried all these other types of interventions. Because if you're responding to a pill, why have surgery, right? But the success rate with the implants are quite high. You know, they usually have a longevity of between 7 to 10 years, depending on how often you're using it. I had gone to one conference and one man, it only lasted him 3 years, but I think he was being sexual 3 times a day. So that's why it kind of wear and tear. This next section here, talking about sexual aids and devices. Now, again, this is something, you know, people have different types of ideas around these. And a lot of times what I'll say to individuals is that, again, as part of the process, that, you know, the principles of, let's say, flexibility, etc., are very important. The other thing is that if you choose to use any of these aids, is that it's important to understand what are your judgments about this, right? So a lot of times what we'll say is that this, you know, individuals say, well, we never used those before, we didn't have to. It's not that, for now, it's more like an addition to rather than a replacement of. So again, keeping the open mind with that. One thing we have here is the elator. This is actually like a penile brace. So a man does not have to have an erection to use this, but it can help support the erection for penetrative activities. The only thing I find with the elator is that if one is engaging in anal sex, it probably won't be strong enough for anal sex. The other thing we have here is the prosthetic penis with the harness. And I remember when I started in this role, I read an article of a man who actually had prostatectomy, radiation, and was on androgen deprivation therapy, and was not able to attain his own natural erection, but really missed having penetrative sex with his partner, who was a female. So he actually used this, and it's hard to see, but there's actually 2 holes in the actual harness. The top hole actually houses the prosthetic penis, and the bottom orifice, or the bottom hole, actually allows the genitals to be exposed. So as this person was actually doing intercourse with his wife, the wife was actually stimulating his genitals, mimicking the same motion that he was doing. So how his brain interpreted it was that he was actually doing the penetration. And it kind of goes back to tell you about how important that the brain is in just like analyzing the situation. So this was something that was really, really, you know, beneficial and satisfying for this particular couple. The other thing that they have different types of sleeves. This is actually a penile sleeve that can go right over the penis, right? The other things that we see as part of sexual aids, things like vibrators. A lot of times people feel that vibrators are just these big phallic looking vibrators, but they're not. They come in all sorts of different types of sizes and shapes. A lot of times men will say, well, aren't vibrators just for women? They're not. They're made for men or couples, right? So the other thing that we see, positioning pillows, lubricants. A lot of women, if they're perimenopausal or menopausal, they might still have sexual arousal, but they're not able to lubricate as well. So the vagina becomes dry during the sexual activity. So lubricants are really helpful in moisturizing the vagina. The other thing, lubricants are helpful if the penis is not fully erect and you're applying stimulation. The lubricant helps to protect the penile tissue. So again, that's important to recognize. And then of course, books and music are, again, other aids that can kind of supplement the sexual activity, right? So what are some of the things that are helpful if you're thinking about incorporating these into your life? Keeping an open mind. You know, remember that nothing is really a quick fix, right? I talk about the analogy of riding a bike. How many people just got on a bike and went off? I did this once, and somebody goes, I did. I'm like, okay. But sometimes it takes time, right, to kind of like, feel comfortable with how it works, how your body's working with that, right? If you are in a partner situation, involve your partner when you're going shopping, right? I had somebody bring home something, the other partner said, what do you think you're going to do with that, right? So you have to have kind of, compliment each other, talk about that, right? Take some time on your own to get comfortable with the item. You're planning it, you're changing up, you're making it sexual. The big thing is make it fun. So those are things that are really, really important, right? And a lot of times if a person is single or just newly dating, like even figuring out what works well for you before you're introducing it to like a new partner. So that those things are important. You know your body the best, right? And again, we talk about mind readers and stuff like that. Even if you've been together like 53 years, you can't always read the other person's mind, right? So that brings us into communication and intimacy, right? Communication. A lot of people don't talk about sex. They just don't talk about it, right? Especially with their partner. They might use a gesture or a touch when they want to indicate that they want to be like sexual, but having the conversation, it can be, kind of uncomfortable for individuals. So again, why talk? Actually what we find is that, having the conversation, talking about sex, your thoughts and feelings will help both you deal with the changes. And again, a lot of times people feel that they try to guess what their partner is experiencing, and a lot of times the guesses are wrong. So, and again, we find that it's not easy to talk about sex and relationships, even if you've been together for a long time, but as you begin to do it more and more often, it makes it easier. One of the things, how to do it, first of all, if you're thinking about like looking at your sexual life, think about what you want in your sex life and your relationship, and ask your partner to do the same. Like what's important. Discuss both your thoughts and work out how you can make this happen, or areas where you might be able to compromise or collaborate. Be clear, honest, and also it's important to kind of keep an open mind about it. And also, talking about likes and dislikes, and pay attention to how your partner is responding. Sometimes people don't feel comfortable talking at all, so they actually will write letters or notes to each other, right? Because sometimes it's easier to kind of put your thoughts down rather than saying, okay, well, we're having this conversation now. It's hard, right? So make writing out a little note. Also, you can suggest to see a relationship counselor together, or a sex therapist can be helpful in talking about these things. And one of the things that we find that there's, sometimes there's like a stigma about like, going to a counselor. And what we find, what really means that someone outside of your relationship or experience can help sort through your emotions. Because basically the emotional and psychological health is really important, especially when you're trying to have a positive adaptation process with this experience, right? When we think about intimacy, is that we have a definition here from Options for Sexual Health. Intimacy involves the feelings of emotional closeness and connectedness with another person, and the desire to share each other's innermost thoughts and feelings. Intimate relationships are characterized by attitudes of mutual trust, caring, and acceptance. And it's so powerful that to have that intimacy with another person. There's a sense of vulnerability, but there's amazing the benefits that you get from it. I actually think about like kind of 4 different domains of intimacy. You got your sexual intimacy, you got your emotional intimacy, how you support each other, you have your relational intimacy, what you do together, and then for some people have the spiritual intimacy. I went to a workshop this weekend, and they decided that there were 65 degrees of intimacy. And so, and when we did the exercise, you can see that there's different ways of how you have that connection with your partner. So again, something important. Benefits that we see from intimacy: it allows for connection and growth, increases circulation, strengthens and relaxes muscles, creates pleasure and relieves pain, fatigue, and stress, reassures love and appreciation and attraction. It takes away from the challenges of cancer and creates a feelings of safety and security, and helps you sleep, more so for some than others. So when we think if you're single, one of the things like being sexually active or feeling attracted can be just as important if you are single. So one of the things, like all the treatments that they are available to a single person as well, whether you want to just focus on masturbation or having sex or want to start a new relationship, we encourage people to really take time to understand and come to terms with the sexual consequences of the treatments. That's really important. And think about how you might share your cancer experience with a partner. So sometimes even, with a close friend, doing some role playing about having a conversation. Think about the timing, honesty around it, and basically keeping it simple. And because remember, it's like you, all of you, are like the best gift that you can give somebody. That's a good thought to keep in mind. So again, when we think about the principles, right? Acceptance, flexibility, patience, and persistence. It's important, if you want, to create a sexual life that you are comfortable with. And just to bring it back to our service, again, there's our contact information there. Basically, when we think about our service, is that we do need a doctor's referral. We do individual clinic sessions, which also can include injection training. And Monica and I actually do an intimacy workshop that's run 4 times a year, because sometimes we find that couples, they get on different pathways and it's hard for them to get back on that same pathway. And with our clinic, it's not just about how the body's functioning, it's about all aspects of your sexuality. So that's one way that we can address that. A lot of times the core principles that we use is like confidentiality and permission. We want to make sure people are feeling comfortable, that they're at a state of readiness, ready to move forward. We have equality for gender diversity and preferences, and we see whether individuals, whether they're partnered or not. If they are in a partnered situation, we really encourage the partner to attend the clinic appointments. We will focus on anything from erectile function to sexual drive to ejaculation and orgasm, mood that might be affecting sexuality, effects of sexuality on the relationships, with the partner. And we also would identify different types of resources and community supports. And then again, additional information and supports here with the counseling services. Even the prostate cancer support groups have been very, very helpful, and again, helping individuals navigate the different experiences that they have. Questions?
Well done.
Thank you. Thank you.